New videos every day.
Hey, and welcome back. This is Dr. Jeff Echols, and I'm here with Kayliegh again, and she's been kind enough to volunteer and let us take a look at some of the extremities today. And when I talk about extremities, I mean things like shoulders, elbows, wrists, knees, ankles, pinkies, all those kind of things. A lot of time people think about chiropractic as working with your lower back or your neck, but actually we're trained in to work with all parts of the body, including the extremities. Have you been having any problems in any particular joint of the body?
I have
elbows?
one bad joint, and that stems from a sports injury. I have my left knee.
Oh, okay, perfect.
So, yeah.
So what we'll do is we'll kind of focus on that. And would it be okay if I gave you a little adjustment on your knee today?
Sure.
All right, very good. Okay, so I've got Kayliegh here on the table. We're going to show you how to examine a knee. And of course, knees are very important. You can't go very far without your knees.
No, you can't.
And we see more and more people having knee replacement surgeries today for several reasons. But oftentimes it's just due to the abnormal stress that's been placed on the knee, either due to the fact that the back is out of alignment and is putting pressure on the knee. Another issue that can really help to degenerate joints is actually poor nutrition. And we're finding out that sugar is actually one of the main causes that can really affect joints. And that you don't eat any sugar, do you, though?
No, I don't have a sweet tooth.
Excellent.
So.
Very good. All right. And of course, also trauma can cause a problem in knee. We see that a lot in football and soccer and different kind of injuries like this. She's been in a few automobile accidents. Do you know how you actually hurt your knee?
Yes, I did. I was on my school's dance team. I was 16, and I popped my kneecap out of place.
Okay. So she
So
popped her kneecap out of place when she was 16, and it's kind of giving you some trouble ever since, okay?
Yeah.
Let's just real quickly address some of the main structures of the knee. This is the kneecap. It's known as the patella. Also, on the outside here of the knee, there's a little, like a disc that lies in between the two major bones of the leg. And that disc is actually covered by a ligament that goes across there. When somebody hurts their knee, it can either damage the ligament, the disc that lies in between the bones, or both. And we have tests that we can determine which of those or both of those. The same is true on the inside of the knee. This is called the medial meniscus. The meniscus is the disc in this case. And there's also a ligament that goes across that to try to hold it in place. And again, in sports injuries, oftentimes those ligaments are disrupted. In the knee, there's also some ligaments that kind of weave around through the bones and hold it in here and hold the knee together. And those can be damaged oftentimes in sports injuries as well. So are you having any tenderness over this spot here?
yeah.
Okay.
Right
From 1 to 10?
Probably like a 5.
Okay, so she's definitely got some tenderness over here on this lateral ligament and the lateral meniscus. And what about over here on this side?
It is tender,
but not as much as on the inside. Okay, very good. And we want to just check to make sure that the patella itself is not roughened or having any problems here. So we're going to just have you contract this muscle. Go ahead. Is that painful?
Yes.
So she's got a little bit of roughing and wearing underneath the patella that's causing her to have some pain underneath that as well. All right, I'm going to do another couple of quick tests, but I'd like for you to roll over on your stomach.
Okay.
Is there any pain when we push down like this in the knee?
No.
Okay, we're going to just rotate your heel in like this and push here. Is there any here?
Mm-mm.
Okay, and we're just putting a little light pressure on here to test the integrity of the disc in the knee. Is there any over here?
No.
All right, very good. Now, I'm going to actually just put my leg right here, and I'm going to lift up lightly on this. Is there any pain there in the knee?
No.
Good. And is there any over here?
No.
All right, good. And is there any over here?
Mm-mm.
Okay, very good. So all of the major structures of the knee seem to be pretty well intact and not a lot of damage there. So we're just going to do a little light adjustment on the knee and see if that doesn't seem to help her quite a bit. So this is just a general mobilization technique for the knee. I've actually had people come into me who had knee problems that have been going on for years and years, and just something real simple like this can oftentimes clear it up as soon as they get up off the table. Other times it takes a little bit more work, but it's a real good way just to kind of get some more mobility in that knee, okay? While I'm doing this, if there's any discomfort, just stop me, okay? All right. So I'm just going to put my hand right behind the lower portion of the knee here, and we're going to flex the hip all the way up like this. Are you having any pain there in that knee?
No.
All right, and then just a little bit of a push here. Very good. That kind of surprised you. Good. All right. And then I'm also going to go in here and work some of these muscles. Or any of this, is this any tender?
A little bit.
All right. So we get it right on this muscle right here, and we kind of work it a little bit. And is this one tender or no?
Yes.
Yes. It's real helpful to go in behind an adjustment like this and just take some of that stress off of the muscles with a little light massage in this area. Kayliegh, your knee was kind of out of place a little bit there. Did you hear it pop when we adjusted it there?
Did. It surprised me a little bit. And that's probably because I never went to the doctor after my injury. So.
Okay, there's for that.
Okay.
All right, always take care of yourself, folks. So we're able to actually help people with a lot more than just neck and back problems, the extremities or joints, and we're very well trained in taking care of those problems there. We took care of Kayligh's knee today. Hopefully you'll do a whole lot better than that. And again, we recommend that if there's any swelling in those joints, always use ice, don't use heat. That can oftentimes help to reduce that swelling. But if the underlying cause of the swelling isn't corrected, it'll just keep returning over and over again. So be sure to get it handled appropriately. Thank you.
Thank you.
Until next time, this is Dr. Jeff Echols.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.